So one thing that I personally am worried about, and I know a lot of people are, is that we're going to have a spike in people needing a bit of help with their mental health. There's so much fear around COVID-19 and people losing their jobs. When it comes to online mental health, how effective is it when it is an online version?
One of the things we know, and firstly, I mean, continue to advocate for mental health in COVID-19. Something I'm trying to make sure I'm being really, really loud about, for the simple fact that we can get a little bit caught up in the virus, and which is important. We need to get caught up in the virus so we can get rid of it. But there's all the parallel problems that occur with such an occasion. Mental health is going to be one of the huge challenges that all of us face, because I don't think any of us isn't vulnerable right now.
Yeah.
Usually some of us in a great place with such high unemployment rates, with changes in relationships and people being stuck together. Mental health, major issue. So I think we all need to keep looking after each other and trying to find ways to help each other when it comes to mental health. Online consultations, what they provide is something that has been missing. And we know that a lot of people avoid going to see a healthcare practitioner for the simple fact that when it comes to talking about mental health, we're not great at it. And especially men, but all of us, let's not categorize. I don't think any of us are great when it comes to that initial moment where you decide to reach out and say, I need help.
Mm.
And where I see the true benefit in online psychology and psychiatry and mental health counselling is that first step, giving people that opportunity to just say, I need help, without sitting in a waiting room, without going through all the other dramas associated with working up the courage to go and ask for help. And I think that people need to be encouraged. Now, whether it's you yourself or somebody you know, to understand you don't have to go and sit in a waiting room. You don't have to medicalize this problem to make it an even bigger thing than it is. You can go online from the comfort of your home with all the things that make you feel comfortable and secure and safe, and you can start that conversation. And then from there, you're in the system, the plans will be in place. If it's going to be more benefit to continue to do online consultations, that's great. If there's a need decided that you might need to come in and actually see someone, then that can also be put in place. But for me, this will be a game changer in mental health management. It's the one thing that has scary projections. Setting aside the virus for a moment, before that even showed up, the concern around mental health in the community needs to be greater. And it's these types of innovations and removing the stigma around mental health and getting people to ask for help, but then giving them the tools to do it, I think will really start to help us, change that trajectory of mental health in the community.
So it's almost like a little bit of a silver lining of COVID-19, in that it will become more acceptable to have online consultations, and also for men and women to approach this. Because I know that in my personal experience, a lot of men don't even have the language to discuss mental health, but they might do something on their phone. They might, they might send a text, or they might do a video conference on their phone. So, in a way, we've had the bushfires, we've had COVID-19, we live in a huge country with a lot of isolation. This, in a way, is teaching us how to move forward in a positive way.
We will start to see people using things, digital healthcare, that they never used before, would never have contemplated. And that's on both sides. That's not patients, that's also the healthcare professionals. Now we're in a place where this is the best choice. And I honestly believe that coming out the other side, all of us will change how we approach healthcare. We will be moving towards more of a system that embraces digital healthcare, and where that sits in our spectrum of what we need when it comes to care, whether it's e-prescriptions or a medical record online or telehealth. And sometimes it's just about the first time. Everything you ever do, the first time is the hardest.
Yeah.
The same with the telehealth. It's always, the first moment will be the hardest. But once we're doing it now, because we kind of have to, the next time you do it, it'll just be like, it's just normal. It's just the same as going to sit in a waiting room.
Dr. Rochford, thank you so much for your help.